Welcome to Beyond Bylines, a podcast of the Bristol Herald Courier. Beyond Bylines is presented by Food City. Nobody does food like Food City. Hi, I'm David McGee. I'm the editor of the Bristol Herald Courier, and joining us today is Amy Moseley from Healing Hands Health Center in Bristol, Tennessee. Amy, welcome.
Hi.
Thank you.
Thank you for having me.
Absolutely. You folks have been busy.
We have been very busy. We have a lot of growth going on right now. We have been able to expand services. We wrapped up a capital campaign to make that happen. So we're very excited. Just moved into a new building, or we still have people in the other buildings as well, but moved into the new building to expand services. And the ribbon cutting is coming up. So we're excited for that.
Well, the Healing Hands has basically been up on the hill near where the old hospital was for a long time. You've moved a couple times now. But for people who don't know and aren't aware, maybe tell folks a little bit about Healing Hands and what you all do.
Yes, so we were founded in 1997 by a group of churches, but the idea came from First Presbyterian Church. And so we started seeing patients in 1997. So we've been around a long time. And we've expanded services as we've gone. We started out being completely volunteer driven, and it's just grown and grown and grown because the need is so high. It was originally for people who were uninsured. The ladies in the mission group at First Pres read an article in Parade magazine that said how many people who work but still don't have insurance and they go into medical debt or just don't receive care. So that's how we were founded, and we currently provide medical with integrated behavioral health, dental, vision, and we provide supportive care through our community health workers. And our mission is to glorify Christ by providing quality, community-supported care for people of Northeast Tennessee and Southwest Virginia.
So how many years has Healing Hands been around now?
So let's see, it will be 29 years in October. So it'll be 30 in 2027, 30 years old. Yes.
Wow.
It's a long time.
So for the longest time, it was primarily medical care.
Primarily medical, and then we added a little bit of dental. And in 2015, we moved, our clinic was on Memorial Drive. We moved to Midway Medical Park. Thought that was going to be so huge. We went from 4 dental operatories to 8. Since then, because the need is so high, we've expanded dental to now have 13 operatories, and our new medical space went from 6 exam rooms to some of them are treatment rooms, triage rooms, but about 15. So we've really expanded our capacity with size and with having enough providers to treat more people. And the reason for that is that the demand is so high.
I was going to ask that later, but let's talk. You mentioned it now. Can you give us a sense of how many people that you all are helping on an average basis?
Yes. Since we've opened, we've helped over 17,000 people. Last year, we served about 2,200, almost 2,300 people. And with our expansion, we anticipate in the next couple of years serving about 3,200 people a year.
And where are those people from? How big is the circle?
So the circle's quite large. It started out just being Bristol, but now we actually have patients from 21 counties.
Oh my.
In our medical care, most of the people are in, the Bristol or greater Bristol area, but our dental care, because there's such limited resources for dental, we go much farther into Virginia and Tennessee because people are just trying to get in where they can get in. Yes. So we serve all of Northeast Tennessee and Southwest Virginia.
So in terms of the impact, just beyond the service piece of it, what is it for people who don't have insurance, that don't have the money maybe to go to the doctor or go to the dentist? What does this mean to them to be able to get this care?
Honestly, it's life-saving. At the end of the day, it's life-saving. If people delay care too long because they can't afford it, and that's typically what happens, then it really impacts their health. They may not know they have heart disease. They may not know they have diabetes. They may be dealing with a severe mental health issue. So it's really bad for the patient, but it's also bad for our community. when we have people that are really sick, they cannot work, they cannot be participating in our community. If they're uninsured, they may end up going to the emergency room, and that they won't be able to pay for that. So the cost, it's so expensive to get care in an emergency room. It's not set up to be your primary care or your dental emergency space. It's set up for you were in a car accident, you had a heart attack. But people who are uninsured, that's often where they turn because they are desperate for care.
So in terms of the need, what is and you all are reaching thousands of people, and we have other entities in this area, Health Wagon up in Wise County, the Appalachian Highlands Dental Center in Abingdon, other people who are doing similar work to what you're doing. But
Right.
What is the unmet need in this area at this point?
Especially in dental, it's still very high. We are on a 9 to 12 month wait list for a new person to get into our dental clinic. I know Abington is on a very long wait list as well. We could probably pop up 3 more places and we'd still, the need is overwhelming. I don't know that we even have a specific number because it's overwhelming. And then in medical, it's even harder to track because what we have found is, so I'm glad we're doing the podcast, so many people don't know about us. So they don't find out about us until something really bad happens.
Some catastrophic,
yes,
maybe.
And Ballad, when they go to the hospital, will tell them about us or in places like us and try to link them with the primary care provider. But we would really like to be able to reach people sooner so that they don't get to that point.
So how do they qualify?
Yes, that's a great question. So if you want to be a medical patient, you cannot have any type of insurance. Now, if someone calls us and they do have Medicare or Medicaid or Medicare or TennCare, we have some great partners that we refer them to. Actually, our medical director, she's at 2 clinics. So her other clinic she's at can see them there. So they have to be uninsured. They have to live in Tennessee or Virginia. And we see people up to 250% of the FPL, which goes pretty high. I think it's on here. So like a family of 5, they could make up to almost $97,000 a year and still qualify for Healing Hands.
Oh, wow. Okay.
Because, if you have diabetes or chronic illness, even though it seems like, oh, $97,000 a year, that's really great. If you're paying completely out of pocket for your medical care, it's not enough. It's not enough to cover it. So that's who we see. Now in dental, all the same things, but we also see people who have TennCare and Virginia Medicaid in dental. And the reason we added this is we were already seeing those patients, but the states did not include a dental benefit for adults. So when they did include it, all of a sudden we were like, well, we can't see you, you have insurance. But there were, at the time that it happened, there were literally no clinics in the area taking it. Now we do have some now because we take it, the Abington Clinic takes it. I think the Health Wagon does. There's a couple, and there's a private dentist. But initially there was just nowhere for people to go. And they've delayed dental care so long too for some of the people that they need extensive work done. And your dental health really impacts your whole health.
That was when we talked to the folks at Appalachian Highlands.
Yes.
They made that point more than once.
Yes.
That if you have an abscess tooth or you have some chronic thing that you're letting go, that can lead you down a very bad path.
Very bad path. We've seen it at Healing Hands. We've gotten a patient in, and the dentist is like, whoa, we got to get you to the emergency room. This is too far advanced. So it's very serious. Your dental health is so important. And same, with your mental health. So we've added that service line. It all goes together. It all goes
so
together.
You touched on it a little bit. The campus is growing.
Yes.
So you guys set out a few years ago to do a major capital campaign and acquired a building. You want to talk about kind of the support that you got for that?
Yes, that would be great. So I guess it was in 2024, we identified, actually 2023, we identified that we really needed to add integrated behavioral health into our primary care model. So what that means is that when a person comes to the doctor, like you go see your doctor, and you might tell your doctor, gosh, I've really been having really, bad depression. I'm having a hard time getting out of bed. I don't know what to do before. And we had a lot of patients that fell into this, or I have a substance use disorder, all different things could be the problem. That we would have to do a referral. And there are great mental health resources in this region, and we still need them, like Frontier Health, Ballad Health. We still need that. But if you can get that person mental health care immediately, it's way more likely they're going to follow through on the care, because there's still stigma. So we knew we really needed to add integrated behavioral health into our primary care clinic. So we set out, and we did it a couple ways. We wrote a grant. The seed money for the pilot was through the Tennessee Department of Health. It was a practice transformation grant. And we were ecstatic when we received it. So that was a big win for us. And we knew we also needed more space because we're adding a provider. We also wanted to fully do the integrated care model, which is where the team can collaborate in real time. The providers, the nurses, the community health workers, the front desk staff. So everyone can be collaborating. Okay, we need to help this patient with this, whatever this is, So we did a feasibility study to see, can we raise the money? There was the building right next to us for sale. We actually had looked at that building maybe 10 years before, but we didn't need it. We didn't have the money for it. But we were like, oh,
it was a larger space too,
right? It's a larger space, yes. So, and we're busting out the seams in the current building, which we thought that building was plenty of space. We had some people, we have an education center across the street that has dorms for our students, but we had some people having their offices over there because we were so tight on space. So we did a feasibility study and said, yep, we can raise the money. And we also wanted to add to our endowment, because providers are expensive. They should be. They have advanced education. They spend a lot of money on their education, so they're expensive to get. So we knew it's not just the building. We also need to be able to sustain the programs and the providers that we have. So it was two parts. We were trying to raise $3.5 million in cash and pledges, and that would go towards the building, and approximately $2 million to the building. Except we went over some, so approximately $2 million, and then the rest go into the endowment. And we were able to completely raise the rest of the money. We raised it before the year was over in 2025, but we have received some donations since then as well. And then we also were raising for planned giving, so that someone, if they wanted to, could leave us in their will. And we were trying to raise $2 million for that, and we also exceeded that goal.
Wow.
So we're very pleased with it. And we had a lead gift from the Care Foundation of America, and that really helped us know that we could do this. And then we had some early gifts from private donors and families, some really large gifts from private donors and families. And we had great corporations that supported us. We had Eastman Credit Union, Food City, Ballad Health. They all supported this campaign. And so that was huge. But what really got us across the finish line, we had about $500,000 left last July, and we had a great donor meeting. I'm not going to say their name, but people might be able to guess. I didn't want to say some names because some people want to keep it on the down low, but I said, we really need $500,000 more. And we asked them if they would consider doing a match gift, dollar for dollar. And so they did, for $250,000. So that got us. We did a letter writing campaign. And so that made more people feel like they could participate. Maybe I only have $10, but then it's going to actually be $20. And everybody really got on board. And we had so many staff and volunteers donate, people from all different socioeconomic backgrounds donate, because they just really believe in this mission. And so we were able to cross the finish line. We finished up the building. We recently moved in. So everything is going really, really well.
That's fabulous. I know you told me that you're planning a little ceremony coming up
Yes, we
for the
are.
new building. You want to talk about that?
Yes, so on April 30th, and it's at our new location, which is 225 Midway Medical Park, which, if you're familiar, if you're facing our existing building, it's to the right. And we actually built like a walkway so that they would, be connected. So we're going to have that from 3 to 5 on April 30th with speakers at 4 o'clock. And people can walk through and see the new building. We do that in partnership with the Bristol Chamber of Commerce, who's always been such a great supporter and advocate for us. So we really appreciate that they do this.
Well, I know the first time that I heard about the integration of mental care along with physical care was when we did a story about the plans for this.
Yes.
I guess it's probably been a year and a half, or
I think
it's been a while ago.
A year.
That we first did that story. But I said then it makes so much sense to me, because you think if someone is having, if they're struggling, they're having some health issues, they probably are going to feel kind of beaten down,
right,
and overwhelmed.
Yes.
Maybe by how, I have this medical issue. How am I going to take care of it? How am I going to pay for it? How am I going to get better? I want to live to see my grandkid, or whatever whatever goes through their mind. So that, to me, that just makes it just checks a box.
It really makes so much sense. And, you look and you're like, why didn't no one think of this sooner? We learned about it through ETSU has I'm going to butcher their name, but it's Institute for Integrated Behavioral Health. And that's run by Dr. Jody Palaha. And she's wonderful. And she's the one that really introduced the model to us. And it's kind of a light bulb moment that you could be at your regular doctor's appointment. If a mental health need is identified, then the mental health provider will come in and you can actually have a visit with them that day and then figure out next steps. Do I need therapy? Do I possibly need a medication? You're not going to probably know you need a medication on day one because they've got to do some diagnosing and things like that. But they can get the ball rolling, and then you can come where you always come to the doctor. Nobody knows if you feel awkward about it. Shouldn't, but people might. Nobody knows what you're there for. And you can come to see the regular doctor. You can come to see the mental health doctor. And if you're a dental patient, you can go upstairs, see the dentist, and it's, everything's there, which is really great.
Something that I meant to touch on, and I'm going to circle back, as they say, but you all have a wide range of providers there. You have a lot of people, and now you're going to have even more. But I mean, they come from, some of them from a long way away. You want to talk about the different programs that kind of mesh?
Yes. Okay. So let's start with dental. So
that's the big one, right?
That's the biggie. So we have our staff dentist, which we have a dental director, a full-time dentist, a part-time dentist, and then the University of Tennessee College of Dentistry preceptor. And that actually is supported. UT pays for that, which is wonderful. And he also will see patients on days that they don't have students sometimes. So basically we have 4 of our own providers. And then we have the University of Tennessee dental students come, and they come from Memphis in 2-week rotations. And they treat our patients. Dr. Schlotthauer oversees them. Then they go back, and then the next group comes. They actually have a car that they use to drive here. Sometimes they bring their own car, but they have one that they are allowed to bring, and we have dorm for them. And that was another capital campaign project that we did during COVID, if you can imagine that. But it was the right moment. We had a large donor, JD and Lorraine Nice Wonder, who have since passed. They wanted to do a big project, and they felt like that was such a need. So that's the students. We also will have in dental, usually they do it like a fair, almost like a dental hygiene fair day. The Wickville Community College Dental Hygiene Program, they come and they'll just knock out a bunch of dental hygiene appointments, which some people probably don't know. That means like getting your teeth cleaned. So it's super important. We also have 3 hygienists on staff. So we have them. And that we have a lot of other students that rotate through, but usually those are people that seek it out on their own. They're looking for shadowing hours or volunteer opportunities because they're wanting to go on to medical school or dental school. So we have a lot of those kind of students. Then in medical, so we have several partnerships for our medical program. We partner with ETSU Family Medicine, ETSU Health Family Medicine Bristol, another long name, but hopefully I didn't butcher that. So we have a partnership with them. So Dr. Lloyd, she works there and she's our medical director. So she's with us several days a week. We also have a partnership with them, but it's actually funded through a grant that the ETSU Quillen College of Medicine received. So they provide another provider all day on Tuesday, which has been huge because we did not have coverage on Tuesday for regular medical. We only had it for mental health. In addition to, so that's, a lot of doctors and residents with that program. In addition to that, we also have the ETSU Quillen College of Medical students to do our health fair every year. And we have King University nursing students, and we have the Tennessee, I'm not going to butcher this one, Tennessee College of Applied Technology, their phlebotomy students. And I believe their RMAs are now rotating through as well. And I should have mentioned too, in dental, we have a partnership with Northeast State for dental assistants that are getting their hours to get certified.
And we've talked about that before, but I wanted to kind of wanted you to go through that and to kind of illustrate how many different hands are involved in this.
Yes.
To make all this happen.
So many. And so many students, and that's twofold. It helps us treat more patients, but it also is workforce development. We have a huge shortage of providers in this area. A lot of people don't choose to come back here to practice after they, graduate medical school, dental school, or wherever. So we really want to give them a great experience. We want them to see, oh, this is a great place to live. I could come back here. And it's just really important that they learn, to me, charitable care early on, because even if they go into private practice, we have so many private providers, physicians, and dentists in our area that will either come on site and see our patients as a volunteer, or we have eye doctors who let our patients come there and they don't charge them. So it's so important for people to know while they're still in school, that's something they can do to give back once they are licensed. So super, super important. And I'll add on that too, volunteers. We were founded by volunteers. We were originally completely volunteer driven, and we still have an incredible number of volunteers. I believe it was over 200 last year, not including the students. And that's everything from dentists, doctors, eye doctors, but also nurses, but also people that are willing to do the lawn work. We had a young man who works in downtown Bristol that wanted to help out, and he did a bunch of stuff on the lawn for us. We have people that help with all of our fundraising events, our board members. So we really couldn't provide this level of care that we do to this many people if we didn't have such great partnerships and volunteers, because we just wouldn't be able to afford to provide this much care financially.
Tremendous level of engagement.
Yes, tremendous level. The community engagement is so important. And when we updated our mission statement a couple years back and changed our logo, that was one thing from the focus groups that came out, is that Healing Hands truly is a community supported organization. It's not about what we did, it's about what the community did.
And you have an event coming up.
Yes, we do.
Later in the month, April 23rd, 24th, health fair. You want to talk about kind of what's available and what folks need to do if they need to come to this?
So the health fair is a wonderful opportunity for our community, for our patients that maybe haven't been in a year, we've been trying to get them to come in, or also for just anyone who, whether you have insurance or not, you can come. So it's a great chance if you want to get your blood work checked, things like that. You can talk to the doctor about anything. Maybe you've got a rash and you haven't been able to get in with your own doctor. You are welcome to come to this And it's super helpful for the students. So the ETSU Quillen College of Students, they do this they do it to help the community. Dr. Kinser runs this program, and he said the number one reason to do it is to help with the community. And if you have new patients you're trying to get in, or patients that are behind on getting their physical and things like this is a great chance for them to get care taken care of. But also the second reason is to help the students learn. So the students, they are with a provider, so they're not solo, so don't get worried about coming. But if you want to come, you need to call 423-652-0260, extension 3, or you can just go to our website. That might be easier, healinghandshealth.org. There's like a link at the top. And we're providing a lot of things: medical exams, which includes blood pressure check, blood sugar check, and labs. If someone needed a sports physical, they could come. We'll do mental health screenings and consults, EKGs, chest x-rays, Thursday only. They'll only be there on Thursday, but Dr. Smitty comes and does that, and it's wonderful. Prostate exams, pap smears, mammograms Friday only, and you'll need to call. But if you call our desk, we can help you. We'll have vaccines available. We have a partnership. I think I left them out earlier, so I'm so glad this came up. Appalachian College of Pharmacy is our partner, and they actually have their preceptor and a student embedded into our clinic. So they will be doing pharmacy consults. So you can bring your prescriptions if you had questions, and they can talk to you about your prescriptions and make sure you're taking everything correctly. Narcan training. Will be giving away a free Food City. Food City is a great partner of ours. They also were a big donor to the Capital campaign. I think I might have left them off earlier too. So
I think you mentioned
them.
Did
I get them
I think
in
you
there?
got them
Okay,
in,
so
yeah.
a huge partner of ours, and we are giving away 2 Food City $100 gift cards. One patient each day will win one. So it'll be a lot of fun and helps the community, and we hope that people will book and come.
Absolutely. Is there anything we should have talked about? Is there anything you want to mention?
I just think that I just want to thank our community and for everyone who has helped us get to this point. And I want to thank our patients. Our patients are what, get me up in the morning, make me want to come to work. We have wonderful patients. Many have gone on to help us when they didn't need us anymore. They've gone on to help us. So I just really want to thank everyone for everything you've done to make Healing Hands a success. And I think too, the need is still very great. So, what keeps me up at night is just trying to make sure that we have the funding to continue on and meet the need of the community, and that we, even as we grow, maintain the quality and the mission and the commitment to the patients, because it really is all about the people that need the care.
Because it's one patient at a time.
One patient at a time, yes. And when you help one patient, you're helping their whole family.
Very good. Amy Moseley, thank you so much.
Thank you.
I appreciate it. This has been Beyond Bylines, a podcast of the Bristol Herald Courier. Beyond Bylines is sponsored by Food City. Nobody does food like Food City.